we are going to get started with our program. There will be people joining us. What I was reminded of this morning is that rain brings flowers in May. And so we will be thankful for rain, right? Okay, my name is Dr. Pam Straker, and I am the program coordinator for the Brooklyn Health Disparities Center. And I have the pleasure of working with some incredible people who have really dedicated their time and their lives, essentially, to ensuring that disparities in health are really eliminated in our communities. I'm not going to speak for a long time. I do want to, at the beginning of this session, give some special credit to people who have helped this day come to where it is. I'm doing it now, so it won't drag on later. So I specifically want to thank Nicole Primus. I want to thank Yolene Goose. I want to also thank LaRonda Sharps, Dr. Mary Valmont, who is going to be helping us with evaluation later on. And now, there are two people who have really been at the forefront with respect to health disparities, and they are Dr. Moro Salifu and, we all know, Dr. Ruth Brown. And I don't believe they need a lot of introduction, but both of these individuals have, for the most part, been here day and night, really working on behalf of our communities. And so I'm going to ask Dr. Salifu to please come and start us off for the day.
Thank you very much, Pam, and good morning to everyone. The president of the campus wishes that he were here to greet you this morning. His name is Dr. John Williams, but he's unable to make it. Our dean of the medical school is here, Dr. Ian Taylor. Thank you for coming. We also have the Commissioner of Health for New York City in the audience, Dr. Mary Bassett. So we have all the various people who are game changers and who are very vested in health disparities in the group today, and hopefully we can come up with some solutions that we can use in our daily lives to bridge the gap in the way we handle health issues in our communities. So I would like to welcome you formally to our spring conference entitled Health Equity, the Past, the Present, and the Future. Dr. Ruth will be giving you a formal, introduction to the speakers and welcome you more formally. But what I want to do in this, my session, is to give you a background of who we are, what the Health Disparities Center stands for, how it is composed, and what are the current states of events in the Health Disparities Center. So this is it. So what is the Health Disparities Center? It's an academic community government partnership. And the goal of this is to reduce health disparities in Brooklyn. By that I mean, there is an academic component which is SUNY Downstate, right here. There is a community component which is the Tosh Institute for Urban Health. And there is a government component to the Health Disparities Center, which is the Brooklyn Borough President's Office. And the Brooklyn Borough President's Office is represented by Sandra Chapman, and she's in the audience today too. So this is the history. In 2003, President Markowitz commissions a needs assessment on the Health Disparities Center in Brooklyn by the then Deputy Borough President Yvonne Graham. And then, subsequently, a number of things happened. This thought was then managed by the Milano Graduate School of Management and Urban Policy, New School University, and this campus issued a report recommending a number of things to be done for health disparities in Brooklyn. What they basically said was that there should be a Brooklyn Institute on Health Disparities. And because it would have an academic, maybe a research component to it, it should preferably be housed at SUNY Downstate Medical Center. And it was the Moro's only academic medical center. All of you know that. But because we want to be able to achieve the common goal of solving the community's problem, you can't just house it at SUNY Downstate Medical Center without the community input. So it said, this has to be in partnership. This has to be in partnership with the Tosh Institute for Urban Health. So SUNY Downstate will serve as a unifying structure, providing organizational support and research for Brooklyn's numerous hospitals and community-based organizations. So this is the model under which the Health Disparities Center was founded. So we have the research, the Brooklyn Health Disparities Center, communicate with each other. There's organizational support that will make sure this survives, and there's a community outreach arm which will make sure that all the things that we are doing within the research arena is translated into the community and vice versa. But I think the goal of this meeting today is to emphasize the community component, because although this is the model, it appears that if you actually look at it in detail, it actually is the opposite. It actually begins from the community and works its way out into the research arena. And that is the principle of community engagement. And I think you're going to be hearing a lot about this community engagement piece as we move along in this conference. So in 2004, the Institute, the Brooklyn Health Disparities Center, was formally established and renamed. You see, this is the Brooklyn Institute for Health Disparities. It was renamed the Brooklyn Health Disparities Center in 2004 by the three parties. It was now the Brooklyn Health Disparities Center managed by SUNY Downstate from the academic side, the Brooklyn Board of President from the government side, and the Tosh Institute from the community side. So the questions are, why did we have this arrangement in the first place? Let's see what the rationales are and what we think makes us the strongest organization to address health disparities in Brooklyn. This is SUNY Downstate data, okay? If you look at the number of enrollments in New York City medical schools, we have the highest enrollment. But nobody knows that. SUNY Downstate is the biggest medical school in New York City, period. And the dean is here. The dean will attest to that when he's giving his opening remarks. We also have a school for graduate studies. Dean Stewart is here to join us. He's the director of the research corps. We have the MPH program, which now has become the School for Public Health. We have the nursing school. We have the allied health professions school. We have a robust infrastructure for research. So this is a perfect milieu for anything that we want to do in terms of research. But keeping in mind that we want the research to really be community focused, community engaged. But the presence of SUNY Downstate gives that possibility for us to be able to conduct very good research. And you can see that the funding for research at SUNY Downstate has been going up by the millions, and it's very, very, very attractive. The second is, why is Tosh so important? And Ruth Brown will tell you more about that as we move along. But why is it so important as a partner in the Health Disparities Center? The mission is to address social and cultural issues that affect health and wellness of racial and ethnic minority and immigrant populations living in urban centers. The second one is, it was named in honor of Tosh in 1992. And you know, Tosh was a big guy in tennis, and he was very influential community leader. He did a lot of good stuff for the communities. So this is really great. The Institute and SUNY Downstate have collaborated in research and training and physically are housed in the same building. So both SUNY Downstate and Tosh are really in this building. I mean, how best could it be that the coincidence is so nice that we can be together in one room and work together? The Institute specializes in developing and studying program interventions to meet health needs, culturally competent services, improved access, health promotion, disease prevention, and early diagnosis and treatment of disease of urban, racial, ethnic, and immigrant populations. This is the mission. And I think they've been doing a great job for a long, long time. And the combination of Tosh and SUNY Downstate is just a perfect marriage that would drive these health disparities issues for now and the future. The ARC is also involved in minority student training models that augment the classroom-based didactic experience of elementary, high school, and graduate students interested in pursuing careers in the health sciences. These are all very important things. And facilitating community health and health empowerment through university-community partnership. So we have great institutions for both SUNY Downstate and the ARC in terms of addressing health disparities in Brooklyn. So the goal of the Disparities Center is then to create, foster, and disseminate community-engaged research findings that contribute to the elimination of racial and ethnic health disparities in Brooklyn. And the structure is very complicated, but we try to get everybody organized in a way that would make every one of the course very efficient. The administrative core is responsible for providing the leadership to the center. I function as the director and principal investigator alongside Dr. Brown as principal and director of the center as well. And we have other members within the administrative core that we work together to make sure that all the various components of the center are run simultaneously and engage with each other. There is a community engagement core. Marilyn Fraser-White will be talking a little bit about that later on. We have the research core. Dr. Mark Stewart will be talking about that later on. We have the research training core. So we have the research training core. Dr. Michael Joseph. Is Michael Joseph here? Yes, Dr. Michael Joseph will be in the research training core. And then we have the research core, and that is Dr. Mark Stewart. These are the various four arms of the Health Disparities Center. And each one of us is independently, but in association with the administrative core, building the center and disseminating health disparities information in the community and trying to make a big difference. So this is how we are linked in terms of how we are interacting with each other and making sure that health disparities is addressed in Brooklyn. This is news conference and a press release from the SUNY Downstate website showing that the Health Disparities Center is now a funded center. From 2003 to 4 up to 2012, there was funding back and forth, but it wasn't enough to actually call us a comprehensive health disparities center until we got this grant. So this grant now formalizes the Health Disparities Center as a recognized institution looking at health disparities in Brooklyn. Again, this is a press release from the DITMAS when it patched when the news came out. Now, in terms of what I showed you about the model, you see, initially the model began with research ending up with community. But now we think that is the reverse. You start with the community and you go into research. That is called community engagement. Because you have to really understand the needs of the community in order to do anything for the community. If you don't understand what is going on, then whatever you are doing is artificial. It may not benefit anybody. So the principle that you're going to be hearing along this conference is community engaged research. Community engagement, community engagement. But how do we do that? So through this process of community engagement, the center was able to identify what we call priority areas for the community that we can begin to address within the Health Disparities Center. So these are the priority areas that we identified in the community using the community engaged methods. And as you can see, heart disease, HIV, AIDS, if you go into the community and actually ask the people who live these things every day, they will tell you that these are our problems. That is what we want to know. We want to know what the community is telling us, not what we are telling the community. Because that is the solution to their problem. And when we help them to address that problem, then we have made a big difference. That's what we want to do. So because of that, the center is very busy right now working on those two projects, trying to see how we can address them in terms of research and then send the information back to the community and see whether that information we send to the community will make a difference in people's lives. So here is the HIV project. This is a cluster randomized trial. We are going to be using 750 black adult heterosexual men, and they'll be recruited from areas with high prevalence of HIV infection seeking to reduce sexual risk behaviors. And the person leading this project is Tracy Wilson. Dr. Wilson has been a very instrumental part of the Health Disparities Program and also a professor in the Public Health Department, and she has outstanding research methodology experience. So we think that this is going to be a very important finding when we conclude, that we can disseminate to the community and get the results out there. We have the other project which addresses cardiovascular disease. This is a sleep apnea project that is being conducted right now. Hopefully we can get some results from that as well. In addition to research and trying to get new information that we can share with the community, we also are actually doing a lot of other stuff, not just research, but other things that we do with the community, partnering with them, going to meetings and, you know, getting our word out there and contributing to other issues in Brooklyn. And what are they? We are in the Brooklyn President's, the Board of President's Health Advisory Committee, the Women's Health Task Force, you know, addressing shortages of healthcare professionals. This is a specific education program that we're involved in. We have the Brooklyn Health Improvement Project that we actually advise. This is a big project involving multiple hospital, community organizations, and healthcare organizations to come up with models that would serve Brooklyn's needs in the new healthcare era. We're taking part in that. There is a SUNY Reach. This is a SUNY-wide, State University of New York-wide infrastructure for research that we actually also advise and tap into for our research purposes. We are also engaged in workforce development. We actually train people to be trainers, so that people would be experts in health disparities research, and that expertise will then translate into the communities. So here we have the PRIDE program. This is a heavily funded program, NIH-funded program that trains health disparities seminars. It's a summer training program. We take minority faculty across the country, and this is now not just Brooklyn. We take minority faculty from across the USA into this campus to train them on how to do health disparities research. This is big stuff that we're engaged in terms of creating the workforce that would understand what health disparities means and then go back to their communities and then do the research that would lead to improvement in health disparities. And then we have the Tosh Institute for Urban Health. This is also NIH funded, the Health Science Academy, the Ross Duke charitable foundations. These are all very good things that are involved in workforce development. I want to stress the point. If we do not educate the right people to understand the right problems in the communities, we would never be able to eliminate health disparities. We can talk about it no matter what we want, we can do any research we want, but unless we actually have the actual workforce which reflects the communities and then send these people back to those same communities to do the job, culturally sensitive way of doing the job, we will never be able to address the health disparities in the way we think we can do it. And then we have this Urban Universities for Health program. This is also NIH funded. This is Dean Taylor's grant. He's the principal investigator on the grant. This is also funded to track workforce. In other words, if you actually look at SUNY Downstate is one of the biggest academic medical centers in the USA that is involved in developing minority faculty, minority students, all the like, in the hope that we can generate a core mass of people who understand health disparities in the future and be able to go to their communities and make some changes. So that is what this grant is all about, to track the workforce development. And this is the press release for that particular grant that was received by the NIH. So there are other pipeline programs, the Health Science Academy, Office of Minority Affairs at SUNY Downstate Medical Center. These are all programs now not directly linked to Brooklyn Health Disparities Center, but we work with them in ways that would improve the workforce area. Early Medical Education Program is one of them. The Undergraduate Summer Research Program is one of them. You see, it's a whole slew of different programs within SUNY Downstate, and we don't talk a lot about them, and that's why I'm going into these details. There are just so many programs in this campus that people don't know about that are actually geared towards workforce development in the hope that people would understand health disparities as they move along their healthcare careers, and hopefully in the future they would engage themselves in the subject and be able to make a difference in their communities. So I'll skip this one. So in summary, the center that we have right now is a unique, it's really unique health disparity center. It's unique in the sense that it is an academic, community, and government partnership. If you really want to solve this problem, you have to have these three components in place. And we are one of the unique centers in the United States that has this model, where we have the Brooklyn Board of Presidents office always present, you have the SUNY Downstate Medical Center always present, and you have a community-based organization like the Ash is always present around one table to solve Brooklyn's problems. I think the workforce development in health disparities is very big. I think it's key. We have to always think about creating new people who understand this subject, and the more we have people who understand this subject, the more we can address the issues in a way that will be effective. And then we have to actually congratulate the Tosh Institute for this innovative ways of getting to reach to the actual people, the use of the barber shop, the salons and telephone methods to reach people in the community is really novel. Not many health disparity centers use this method, and I really am very proud that they are able to make it work. Okay, so that is the end of my talk, and I would now introduce Ruth Brown, who is the CEO of the Tosh Institute for Urban Health, to come to the podium and then formally welcome you.